Welcome all to Raw Online. So today we are going to see CRASH 3 trial. So before having a look at the CRASH 3 trial, we'll recommend you to go have a look at the CRASH 2 trial. Okay, the CRASH 2 trial is about use of tranexamic acid in trauma patients. Okay, whether to give in less than 1 hour or 3 hours. Okay, if the patient reaches to your emergency department within 3 hours, if you can give Trapic 1 gram bolus within 10 minutes and next 1 gram over 8 hours, there are some mortality benefits. This is what CRASH 2 trial says, that is within 3 hours, right? And the benefits are more if you can give in less than 1 hour of insult or injury. This is what CRASH 2 tells us. So now we have the CRASH 3 trial. So this is effect of tranexamic acid on death, disability, vascular occlusive events and other morbidities in patients with acute traumatic brain injury specifically. Okay, so CRASH 2 was released in 2010 and CRASH 3 coming in 2019 in Lancet. Okay, the clinical question is, in patients with TBI, does Trapic or the tranexamic acid under 3 hours from injury compared with placebo reduce the head injury associated mortality, in hospital mortality within 28 days? Okay, so basically the question is, can we give Trapic or other tranexamic acid or not within 3 hours from the injury? Does it have any benefit? So background, we know there is a TICH trial. The TICH 2 looked at the use of tranexamic acid in spontaneous ICH but not trauma related bleed. Okay, there are 2 small trials, one in India, Colombia and Thailand with number of around 508. There is no statistical improvement in mortality. Of course, a meta-analysis showed some mortality benefits as well. So this is the overall thing as far as the trauma bleeds is concerned and TBI is concerned. So now we need to know whether the tranexamic acid can be given in a TBI patient, whether there is benefits in giving it less than 3 hours, because CRASH 2 has said us that the more early you give, it's better for mortality benefits within less than 3 hours. So CRASH 3, we are going to evaluate specifically for TBI, traumatic brain injury. So this is almost shares the similar design from CRASH 2 as well. Randomized placebo-controlled trial. The random allocation was done with packs prepared with randomization codes from an independent statistician. He just blinded both of it, and the physician will not know what exactly is receiving, whether it's a placebo or a tranexamic acid. Though both the participants and the study staffs are blinded and pre-specified subgroups included like how severe the head injury is based on the Glasgow Coma scale, based on the consciousness and stuff. Then the time to tranexamic acid and the age, everything was pre-specified subgroups were created. And multivariable model was used to control and match the age, systolic blood pressure, the TBI severity and such. So it's going to be a well-matched group analysis. And outcome data was collected at the day of 28 or at discharge from the hospital, whichever is earlier, or at the death, whichever comes first. And this is also by intention to treat analysis.